Hi there, I'm Dr. Brown, the founder of Restful Sleep MD, where I help busy women like you prioritize sleep as well as improve the sleep of their children. So I got a question about a 5-year-old who wakes up multiple times at night, and I really wanted to make this video to help guide you on what to do if you are that person who maybe you had sleep trained your child and things were good and they went through, with development, and some, people call them sleep regression. Those are just developmental changes. And now they are waking up frequently at night. What's going to happen, or what should we do? So one thing I want us to know is about that age 4 to 5, and sometimes even in some children that are about 3 years old, they start to drop their daytime nap. And this is different from every child. Usually children at that age of about 3 to 5 sleep anywhere from 10 to 13 hours. And so somewhere around that 11 to 12 hours is where I see most children. And some children may need a little bit more, some kids need less. And at this age, again, they may be fighting naps, or they're just not napping anymore. I mean, soon they're going to be in kindergarten anyway, so I think it makes sense that they no longer need a nap. And the other piece is that once you've determined how many hours of sleep they need to make sure that they're getting sufficient sleep, is now looking back to say, why are they waking up in the middle of the night? And there's several reasons that they could be waking up. One of the ones that I think is really important to address is if there's a medical issue. So if they're in pain, if they have any breathing problems, if they're snoring at night, or if they have very restless sleep, or things like that, that may be concerning for a medical sleep disorder. So things like sleep apnea or restless leg syndrome can happen in young children, actually, especially if you for restless leg syndrome. I see that frequently in children who are picky eaters, and who best defines picky eating than, your preschooler and things like that. So if your child is having a lot of restlessness or maybe complaining that their legs hurt or things like that, bring that to your doctor's attention so that they can test them or assess them or evaluate them for restless leg syndrome. And then, of course, if they're snoring, then you want to make sure they don't have sleep apnea, because those things can wake you up at night, in which case you can't ignore them waking up at night. You need to pay attention. In any case, you shouldn't ignore them, but that will help you know what you need to address. The more common reason why children do wake up at night is usually behavioral. And one thing that the most common culprit I see is what we call sleep association. So even though the issue is really, we're noticing more when they wake up in the middle of the night, I want us to trace our steps back again to the beginning of the night. What is happening at bedtime, and how are they falling asleep? If they're falling asleep either with you holding them, or they're twirling your hair, or they're rubbing your arm, or you're just present, you're laying in bed with them, or sitting in bed till they fall asleep, all those things are sleep associations. Essentially, what that means is that they need your presence to fall asleep. And this is normal. Most everybody has some kind of sleep association. For me, it's my pillow, right? I fall asleep with my pillow, and if in the middle of the night my pillow falls, I'm gonna wake up, because we all wake up in the middle of the night. We all wake up about 4 to 6 times at night, but we're never aware of it most times, because what was present for us to fall asleep was present when we had that very brief, what we call arousal. But if that association is not present, then you wake up more, you're fully awake. And that may be what's happening to your child. They fell asleep, the last thing they remember was, mommy's body right next to them, and everything was really cozy and comfy. And now they wake up and it's like, wait, what happened? So they need your presence. So again, we're moving back to the beginning of the night. And how do we deal with that association? I usually recommend, sort of a gentle approach, whatever works for your family, because most times this is not something that happened overnight. So I recommend really being patient and consistent with you and with your child. So the first step in really dealing with those awakenings by addressing the sleep association, or how they're falling asleep, is to help in helping them to gain independence at bedtime is, guess what? Having a fixed bedtime routine, a set bedtime routine. So really having this calming, relaxing activities at the beginning of bedtime or at the beginning of bed that really leads them to the direction of the bedroom. So it may be reading a book, it may be, taking a shower, it may be wearing their PJs, whatever those activities are, making sure it leads them to the direction of the bedroom. The second is setting expectations and letting them know that it is time. You're now a big boy, big girl now. It's time for you to start to fall asleep by yourself. So I think it's important so it doesn't feel like you're sneaking up on them. And so I think it's important to set those expectations. As much as our preschoolers tend to fight it, they love structure. They love the predictability. They don't know it yet. But they do, and it's very helpful for them. So really keeping that structure, setting expectations in place is very helpful. Now, you're done with your routine, you're in their bedroom, depending on what they need to fall asleep. If you used to lay next to them, or they were touching you, or you were touching them to fall asleep, this is where we're going to work over the next, say, 10 days or to 2 weeks on getting your presence out of the bedroom for them to learn to fall asleep. It's like you're making them depend on you less and less. And so this is how I recommend doing it. Again, this depends on where you're starting from. If you are previously sitting or laying by the bed, I would recommend that you grab a chair and sit on it. Sit in the chair and you're just there and tell them, Mommy's here, it's good night. And that's it. And you really avoid any engagement. They want to talk, they want to complain, they want to try to hold you or pull you back in bed. Arms and legs belong in the bed. You know what I mean? So you're essentially just really calmly reinforcing that, saying it is time for bed. And then when they fall asleep, you leave the room. That's it. Then over 3 or 4 days, you move your chair gradually towards the door, up onto the point where you're at the door and they can see you. And it's the same response again and again. If they get out of bed, you gently lead them back. You don't say anything. It's time for bed. You just gently take them back to their bed and tuck them back in. Okay. Then now you're at the doorway and they're falling asleep, but you're at the doorway. That is incredible progress. The next step is for you to move out of view. Okay, so you're at the doorway, but out of view. And you may need to say, Mommy's here, shh, good night, or something. But you're, again, trying to be as monotonous, as boring as possible. Okay, so that's honestly what you need to do. Essentially, you step by step transition them to staying in bed by themselves. If they have, some anxiety, sometimes we'll use transition objects, so like a lovey. You can put them in charge of taking care of, their stuffed animal whose mommy and daddy is not there. And so they are in charge of taking care of that stuffed animal or whatever. So once you can do that, then they focus less on themselves and they start to focus on, the lovey or whatever it is. Now, after this, if you're still needing to stay, usually, again, this should last about 2 weeks. Now, things happen. If there's an illness, if there's travel, you want to try to move to when you restart that training, you want to stay as far as you can. So maybe you move back to the doorway and you stay there. Again, restating those facts about falling asleep. It's time for bed. Mommy's here. Go to bed, That now, when you're done with that, sometimes if some children, are sticklers and they still need you, you can start to do little check-ins or little checks in that sense. Okay, I'm going to step away. I want to go and brush my teeth, or I'm going to drink a glass of water or something. And so essentially what it is you're running really mini errands and then you're coming back. When you come back, if they're still awake, you want to say, great job staying in bed, and you sit there until they fall asleep. So that may be something that you may need to include depending on how easy it is to get them. Now, what happens when they wake up at night? What this method will do is that once they start to learn to fall asleep on their own at bedtime and their brains wake up like their brains always do, they realize, oh, I fell asleep on my own, and so I can re-fall asleep. Now I've woken up. If they're not and they're still coming, what I want you to do, again, this may just be for a few days, is to guide them back to their bed, put them in, reassure them it's time for bed, it's not wake up time, and you leave the room. Okay, you can, again, if at that point, say for instance you were at the chair level next to the bed, you may need to sit there, but again, you're going back to where you were when you put them to bed. All right. Another thing that I would recommend investing in, it's not that much of an investment, but a lot of families do well with it. There's a lot of children this age do well with it, is getting an okay to wake clock. Now, this okay to wake clock is just a clock that changes color, right? So you could make it like red when they're supposed to be in bed, and then set it for, if they wake up early or something like that. Say for instance, you would like them to wake up at 7 a.m., but they're waking up at 5:30. Then you want to set it for maybe 6 a.m. and just let them know you can't come out until the light has turned green, right? So even if they do wake up at night, they see that, they know to stay in bed. Right now, when you wake in the morning and they stay in bed, you want to just really lavish them with so much praise and positive affirmation, even through the process of getting yourself out of the room. When you're seeing them following instructions, when you're seeing them listening, you want to say, great job staying in bed. You're doing such a good job. You're such a big boy, such a big girl. You really want to affirm them those positive behaviors. And if they are like screaming or complaining, you just want to ignore the negative. Really, this is something that's been shown to be very effective and has been shown to work. But again, I want to state the fact that patience and consistency. So if you're going to do this, you want to try to follow it through as best as possible. Even if, things happen, you fall off, or, things happen, whatever that is, you can go back to where you were and just continue. So I hope this has been helpful, and this has answered that question about why your 5-year-old is waking up multiple times. It's coming back to the basics, really addressing that nighttime sleep, how they're falling asleep at night, that will impact how you respond or how things go when they wake up. All right. I would love it if you subscribe to my channel, if you share this video, comment. I would really, really appreciate it, because this is how it gets the word out there. And until next time, I hope you rest well.